Aho, kitipilo hele, yesipi yayani, lasawanwa.
Hello, and welcome to Among the Shawnee, a podcast for absentee Shawnee tribal members. I'm your host, Mindy Longhorn, Media Director for the Absentee Shawnee Tribe. Today we are going to talk about a new and exciting program being offered by the Absentee Shawnee Tribal Public Health Department and some fun events that they have coming up next month. We've got registered nurse Rita Hunnicutt back.
Yes, ma'am.
And newly promoted Director of Public Health, Sianna. Welcome back to the show.
Yeah, thank you.
Thank you.
For
Congratulations on
Thank
your
you.
promotion. So you are now the new Director of Public Health.
Yeah.
Very exciting.
I am super excited.
That's exciting. So let's start with this program that you guys are getting ready to start, and it's called Start Smart.
Right.
Right?
Yes.
Okay.
Yes.
And let's just look at this gorgeous flyer.
They're
Look at
amazing.
this.
So
Look at that model.
yeah. So I started Start Smart. Me and Barbara Caldwell, our nurse practitioner, started working on this. It's been a rough road. It's been about 2 years or so to get this program together, but I really think it's going to be worth it because it's going to be a prenatal home visiting program. It will not replace OB care. But it will add to it. So we're hoping to go into the home with early pregnancy, do some what we call modules or visits, and they go over anything and everything that you could possibly want to know as a newly pregnant mother, or even veteran mothers would probably enjoy this program because you never know what you could learn with new information.
Or if you haven't had a kid, it's been 10 years or something.
Yeah, and
maybe.
it is, and it
like
is
a refresher course.
Yeah, a refresher course. That would
Right.
be perfect.
Right.
It is kind of built towards new mothers, of course, but I think just how we have it set up, that almost anyone that is going through pregnancy right now would definitely benefit from it. We went to a training with a program called the Family Spirit. And this is a evidence-based program that has been around for about, I want to say about 5, maybe even 10 years now, I guess. But it's Native American based. And we went and took their training, and we took their knowledge and then put it all together into this program. So the only thing that I would say that we have added to this program, which I feel especially proud about, is that we're added breastfeeding to it. So we will actually have a certified, internationally licensed.
I was going to
That
say,
was me.
she's on the show right now.
Yeah. Internationally licensed breastfeeding counselor. So I do have what they call an IBCLC. So I can actually help mothers with any kind of breastfeeding complications that they may have, or just give regular education about breastfeeding, and just maybe help, just anybody that would like to, have that good experience. Because there's just so many mothers that I've talked to that, they really had, not the best experiences with breastfeeding, just because they didn't have that extra time in the hospital with the nurses, because the nurses are busy. It's it's not anyone's
They're doing
fault.
their job.
Yeah, they're doing their job,
right.
and they are rather busy. So they've got however many patients on one floor, and might not always be able to take that extra 5 or 10 minutes to help someone breastfeed. So I'm hoping to be there and do of course, the prenatal visits, which would be before the pregnancy. And then we're hoping to extend this program goes to about 2 years old. So
Wow.
we're hoping to really be a resource and a staple for these new families that are starting.
So who is eligible for this program?
So right now we are going to start it with Native American women or women carrying Native American babies.
Okay.
And then we are going to start with Potawatomi and Cleveland County.
That was you knew what I was going to ask. I was going to say,
So
where
look at me
at?
being so good.
No, that's good.
No, so we are going to start there. We are looking at funding right now and grants through the Southern Plains Tribal Health Board. They are helping us a lot with this program. I'm super excited to have their support. And so they are actually right now have already turned in one grant to see if we can have some more funding. And they're actually going to apply and will be a sub-awardee to another called a MFE grant. And the Southern Plains Tribal Health Board is working on getting that also so that we can also have that on board. So we're hopefully, Sianna has been really helpful with this to maybe even start bringing more people on board for the program and also getting, things that we would need for that our program itself, like in incentives, and we're hoping to be able to help out with we want to help out with car seats, of course, but that all kind of depends on funding. But we do have a few incentives right now that we're hoping to help out our mothers with. But eventually, with funding, we're hoping to help with diapers and lotions and just little things that you don't know,
little essential needs.
Yeah,
and they're not cheap. As you just had a baby, diapers are not cheap.
All
that stuff.
All that support, because we want to definitely start with the education, of course, because that's going to help them get a really good base to improve their family and have a really good family unit and all that good stuff. So we're kind of hoping to, but then we're extending it to hopefully to also help with other needs and stuff too.
So do you have to be a current patient?
At this moment, yes.
Okay.
But that is due, of course, again, to funding. So we're hoping, again, to right now it's me and then Barbara's helping me with like anything out of my scope of practice, which nursing kind of has to fall within that. Barbara will be helping me with.
Okay.
But it will just be me at the beginning doing the home visit. So
as if you don't have enough to do already.
I'm going to love it. This is kind of my niche. Mm-hmm. This is what I love to do. So I am hoping that I won't get too burnt out too fast, but I will be watching that. And but we're hoping, we're really counting on the Southern Plains Tribal Health Board, and they really do great work. So we're hoping that we can start getting funds to maybe help increase that.
Mm-hmm.
So once I'm hoping in the next year or so that we'll be able to grow it to almost pretty much anyone that is pregnant, basically. Right. So, but we're going to start with our tribe. We're going to start with AST and start with our patients. And then if we see the need for it to grow further and have the availability to do that, then we will do that.
Or just clone you. They're going to need some more of you.
Oh, no, they're not going to want to clone me.
You're going to be busy.
Yeah. So, but I really think that this area, this tribe, other tribes in this area, and just the women in this county alone and the near counties around, it's just a need. It really is. A lot of people don't, see it, but when I look at numbers and statistics, Oklahoma is in a sense has almost the highest mortality rate for infants. And that mortality rate is any child under the age of 1. And we have the highest rates we're among one of the higher states that has a really high rate for that. And that's just, in this time and age, is just really, we shouldn't be seeing that. We just really shouldn't. And so it's time for us to kind of get out there and start, get back out there, get back out to these mothers and these infants and really start improving their health.
Change it for the better.
Yeah.
Because I think I was Googling this yesterday, like Native women that prenatal care access is very low. You're right. the
Yeah,
statistics.
and then we're also out. Well, forgive the boonies, but we're also out in the boonies, and so rural healthcare is always been an issue. Like just from day one when we started, back in the day when they were riding horses. So it's just kind of been that thing, and so. Rural is just one of those things that's always been that issue. And I think with home visiting, I think that's the key. I think when you can take it to them, I think that's where the availability becomes open.
And then maybe they'll start on a good path.
Oh yeah, and that's
called
kind of
start smart.
Start
I like
smart.
that.
Yes, you need to start smart. And don't try to say that 3 times fast.
No, we tried. We can't. You might end up saying something else. So I was wondering, are there any other tribes in Oklahoma that offer this? Because I was looking and I didn't see any. I mean, I don't know.
Okay, so our federal IHS system has done prenatal visits for a while. They are working on IBCLCs at this point, but there's only about a handful. I think there's maybe 1 or 2.
She said 3.
Did she say 3? We actually had a meeting with an IHS director of public health in Clinton or Watonga, and she was giving us some insight about it. And yeah, they're just not a lot available to the Native American.
See any? I mean, I was Googling it. And
I believe Watonga has they have like the visits. I think they do the prenatal visits, but I don't believe they have an IBCLC yet there.
So you are like the first.
So
really,
I'm hoping, I'm hoping to get it. I think out in western Oklahoma, the rural,
it's very
farming.
rural.
Yeah, it's very rural out there. So I think they've started it out there, and it's kind of been they've started it a little sooner than we did. But I feel like it's just as necessary here as it would be out there. And so I don't know of any programs like this. I think when I was researching it, there's one in Tulsa, I believe.
Okay,
or all the way down in Ada.
Yeah, so Ada has, so we did,
okay.
that's right. I'm sorry, you're right. Thank you. I believe we found some in Ada, and I don't know if I know Ada has IBCLCs, but I don't know if they do home visits yet. We haven't got with them yet, but we're hoping to form a friendship with them and kind of learn from them also. And then I talked to a woman who does it in Tulsa, and she's got it down out there. She has it really down, but she goes to them too out there. So, but yeah, as far as here in Central,
this is it. So you're the first. So this is exciting.
Yeah, I'm super. I'm super excited. I really am. Like, I'm trying not to grin cheesy.
No, but that's great. So start smart.
Yeah.
You didn't pick the name, by the way. Because I Googled that, Start Smart. And it was already some program. I think it was on a state website.
Yeah, no. So that was Dr. Lofgren.
Let's give him a shout out.
Yeah.
For us having to stumble over every time we say Start Smart.
Yes. So we so actually I about 6 months in, I decided that it was not feasible for me to try to do this on my own and try to like build a whole program on my own. So I started having meetings, and Dr. Lofgren was nice enough to kind of join the group, and we kind of came up to it all together. I had about 4 or 5 names. And we kind of had one meeting really just to kind of, what do we want to call this? What do we want to, what do we want this to look like? And we kind of had a whole group, me, Barbara, invited like pretty much the clinic, like IT, we did media, we did, we just like invited everybody to come and say, hey, be a part of this, program. We're going to need everyone to do it. And so, media just got a new Danielle, and I asked Danielle to look at some pictures I had stole from a friend.
The gorgeous model.
I stole from a friend, and because I thought she would be a perfect representative of what we're doing, and I gave them to her and told her kind of what colors I wanted to stay with. I wanted to kind of stay with the clinic colors and all that good stuff. And they came up with this beautiful pamphlet.
It looks good.
Right. And so you will start seeing them in August. I am doing, it will be done by referral system. So say you are expecting, or someone expecting, there's 2 ways to get a referral to the program, because we will need a referral. or a consult, however you want to do it.
You couldn't just walk in.
No. Yes and no. So I'll explain that. So as a patient, there are two ways you can do it. The first way is if you go to your regular provider, they run a pregnancy test and you're positive. The provider will put in a referral, or what we call a referral, and then I'll call you within a week or 2 weeks of getting the referral. So it will have to kind of go through that process. Another way is Barbara Caldwell has the public health clinic that we do Monday through Friday right now, and we do pregnancy tests in that clinic. So you can come as a walk-in Monday through Friday from
Tuesday through Thursday.
Oh, I'm sorry, we changed it. Look at the director doing her
Tuesday through Thursday.
Tuesday through Thursday.
Tuesday through Thursday. My apologies. Tuesday through Thursday, we will be doing our public health clinic.
You have your STI
Yes,
clinic.
I'm going to plug it in. I'm going to plug it in every time I get a chance.
You've educated me for years. Yes. Never said that. It's STI.
But yeah, but we're going to have that clinic. And then we also do pregnancy tests there. So you can also come there, get a pregnancy test done, and Barbara can put in a referral for you.
If you test.
Yes,
there.
if you.
Okay.
Now you do. Yes, you do have to test positive.
Yes, right. But if you walked in for your test, then you could start the program.
Yeah. So one, those are the two ways that you can.
Or a referral.
Yeah.
Okay. Gotcha. Yeah. And then you're looking at, like you said, up to 2 years.
Yes, 2 years old as and truthfully, if you start the program and you don't feel like it's something that would benefit you, of course, we're not going to hold. I'm not going to keep knocking on your door for 2 years.
Right.
But if it benefits the family, benefits the unit, then we're hoping to extend it to 2 years. And like I said before, if this program does see the need, we are looking at it to extend it to the age of 4.
Wow. Okay. So you're really going to follow through.
Oh, yes. Yeah. So the Family Spirit, like I had said, they have 2 separate trainings. They have one for the younger prenatals, and then they also have a get ready for school kind of program that you can go and learn about too. So I haven't done that one yet, but we need to, you got to start, see if you need that need, if that need's there, and then we can go on from there.
So this is starting in August.
Yes.
Okay.
Mm-hmm. Yeah.
And we've got some other things that are going on too, right?
Yes.
That I think we wanted to plug. I know you've got a lot. I feel like you have a lot of things going on.
A lot of fun events coming up. But yes, there's a lot of potential for this program. I'm proud of Rita and our team, kind of just supporting her and getting it, started. So yay.
Yeah.
Rita.
Well, I'm excited to see it take off.
Yeah.
You may have to come back again and we'll promote it again.
But we do have some other events going on in public health. So a lot of people might already know about our Elder Fun Days for our elders.
And what days are those? If they don't know, they should know.
We are trying to work on getting them out to people who aren't on social media or who aren't on the Title VI program, so kind of in that middle. We're trying to find ways to get out to them. But our next events for August are going to be the 13th. We had to actually change the date for that because one of our people is going to be out. So the 13th at the Resource Center, 11 to 1. You do have to RSVP to that one and the one on the 20th at the Shawnee Title VI building. Because you're going to get supplied with cooking demo food. Jaden is our cooking demo guru.
He's doing so good.
Yeah, with Tara.
He's been on the show and he did not bring samples.
He's scared to come back.
He probably will never come back.
But yeah, Tara and Jaden are heading the Elder Fun Days. They're doing the cooking demos, and then they do fun activities after that. Lately, it's been bingo, but they also do like chair volleyball or different little activities.
Okay, I like the Plinko game. I'm just personally like the Plinko game.
That would be fun.
That's just me.
So yeah, August 13th, Resource Center, 11 to 1, and then the 20th, Shawnee Title VI, 11 to 1. Please call Public Health or Jaden. Jaden Watson in Public Health to RSVP.
Because for the supplies.
Yes.
That way they'll know how many. That makes sense.
Yes. Yeah. And then they do host chair volleyball, and this is open to any elder
it's not
in the community.
Not a league. It's not, it's just for fun.
Just to come and play.
Be
so it's
active.
open to any elder. in our communities. The next one is going to be August 26th from 11 to 2 at the multipurpose building.
Yeah.
Okay.
And they'll provide lunch for that, I believe.
I mean, that's a win.
Yeah. I mean, food and exercise. What
Why
else do
not?
you need,
Yeah,
right?
you got me at food.
Yeah.
That's it. I'm in.
Yeah. And then there is one in September. But we are going to put these in the tribal newsletters and on social media, and then we'll find a way to
Get the
try to
others.
get it out to the others.
Get the
as
word
well.
out.
Yeah, like we're gonna have to figure out maybe like back in the day when they did a phone tree or something.
I don't know about
don't know.
that. I don't know about that. That's a lot of work. But, I mean,
Yeah.
yeah.
But if we have your contact, we will call you
There you go.
and update you.
Or email. Some elders have email.
Yeah.
So,
Yeah.
yeah. Not all
Or
of
text you if we need to. We can do that as well.
Just
Yeah.
inundate them.
Yes.
So those are coming up. Anything else before we get to your next big fun event in September?
For August, we do have a new employee starting next week, Vivian. She's going to be replacing me
Oh, so
for
she's
my
a new
community health worker,
Okay.
and she'll manage the caregiver program as well.
Might have to have her on the show. Think we
Yeah.
could
You know
convince
what?
her?
think so.
Yes,
Maybe.
I think so.
Yeah,
I mean, you guys have been on, 3 times now, maybe, I think. So
Yeah.
it's not
I
bad.
think this is my second time.
Okay, I think we did one without you.
Yeah,
The
with Tara
one-
and Jaden.
Yeah.
Okay.
Yes, because yes, you were out. Yeah.
Having a baby.
I know.
That's
I
right.
know,
So let's
right.
plug that again.
Yeah,
Look at that flyer. I love
I don't
it.
know how I feel about it now.
Oh, they're
They're gorgeous.
It's perfect.
It's
It all came together and I was so worried about it because
Nope, it's perfect. It's
yeah,
perfect.
well, I meant beforehand, and then because the process, I couldn't find something that represented what I felt like we were doing, and all the pictures online were just.
We struggle with that, and we've even tried the AI. You tell it what you want, and you're getting it's
just
not what
doesn't-
you want. No,
AI is.
Yeah, and then
Yeah.
I was like, and then I really did pull her arm though, so I do appreciate that what she did because it makes it makes
it's
it
just,
yeah.
Yes.
Well, thank you guys.
Thank you so much, really.
You-
Truthfully.
it really is outstanding. It's a gorgeous flyer.
Right.
So.
Thank
Well,
you.
thanks.
So now, do we want to move on? We've got something else.
Yes.
Yes.
The health fair,
Yes.
which happens every year.
Mm-hmm.
Yep.
This year, September 18th,
Yes,
Right.
Friday, September 18th, 2 to 4.
2 to 4. And it's got a little theme this year.
Yes,
Yeah,
we
so
did.
Lofgren wanted basketball, so we're
mean-
doing basketball theme. So come hustle for your health
I like
Yes,
that.
I do too.
is our slogan.
Yeah.
At the Little Axe Health Center, we're gonna have lots of fun activities for everybody.
Yeah.
We got little face painting for the kids. I know it's during school time, but if you're available, please bring your kid.
Right.
We'll have
right.
face painting, free snow cones for everybody.
Wow.
We'll have actually a Narcan training, and then we're going to try to do some chair yoga sessions and then also chair exercise bingo sessions as well.
Prizes. It looks like there's lots of prizes
Yes.
on here.
yeah,
Door prizes.
So we're gonna for the door prizes we're going to play like a bingo game. So at the very front we're gonna register everyone, and we're gonna give them a sheet that will have like a bunch of like where the booths are and all that, and then it'll like just say individual like booths, and then they will go to those booths and they will mark them off, and as soon as they have a diagonal, vertical, and a horizontal, and as soon as they have those,
Oh, that's
they
fun.
can come and get a ticket, and then that puts them up for the drawing and the prizes.
That's fun.
Don't forget to fill out the survey on the backside
Oh yes,
of that as well
I
to
don't
get your
forget
ticket.
that
But yeah, so we'll have a lot of prizes, a lot of booths of resources in our facility as well, but also in our communities too.
Yeah,
Um,
I think we got a really good balance this year.
I think usually they have other agencies. The bank shows up, housing
Yeah.
authority.
Yeah.
Sometimes
yeah, we
even
try to get all the
477.
tribe to be involved, and then our other partnerships within Cleveland and Pottawatomie County.
They're all
too.
there. So if you
Yeah.
need lots of resources,
Yes.
it's
it's a
definitely
one-stop. Plus prizes.
Yeah.
This is live band too.
Yes.
Yes.
Wow. Okay.
Yeah, so we have a musician within our clinic, and him and his band. We commissioned them to come out and do some music, so it'll be good.
It'll be fun, and that's
Yeah.
coming up. That's in September
Yes.
18th.
September
Yes.
18th. And then if you feel like it, we are going to have some contests as well.
Super excited about these,
Open
by the way.
to, so we'll have like a little kid age group, adults, and then an elders.
What kind of
age group.
contest?
So
Is
we're
it
gonna
basketball
have,
related?
It is
I
basketball.
figured
It's
that.
basketball
I figured
related,
that.
yeah.
Okay.
So we're going to have a little free throw contest. We're going to try to do a 3-point contest. And then we have a little like basketball arcade type game
fun.
too.
Yeah,
Okay,
so
so if you're really good, this
Yeah,
you can come and win
you'll
some
win
prizes.
some prizes.
Yeah, I'm really excited about this year because it's, we got back into the swing of things of having health fairs again, a couple years ago. And
COVID stopped everything.
Yeah, and so
right.
we're kind of just gotten back in the swing of things. But I think this year, with the team that we have and everybody that just got really involved, the community got involved, the clinic got involved, and so I really think this is going to be
might be the
really,
biggest one yet.
Yeah,
I mean,
Hopefully.
yeah, we're so excited that, and we're really, this one I think has come together really nicely. So
Yeah, so
September 18th.
shout out to my team and the clinic for all of their support
right.
for all of our different events too.
This will be a good one. So you need to make plans. September
Yes,
18th.
please come.
Please
Yeah.
come. Yeah. Anything else that we didn't touch on that you're doing? I feel like you guys are doing a lot.
We are. What? Oh, I meant to. Free snow cones.
Oh, yes. Free snow cones.
At
That's
the
right.
health fair.
Yes. And get your face painted.
At the health fair.
At the health fair. Don't just come to the clinic for a free snow cone. Probably won't happen. But
I mean, health is a balance. Where you got to be healthy,
It's
and
just
then
all
you
about
have to have.
moderation.
Yeah,
they do make
Yeah.
sugar free, though.
Yeah.
They
Yeah,
have
do.
sugar free.
They will.
do.
Yeah, I'm
so
sure
we need
they
to point
will.
that out for people that don't need all that sugar.
Right,
That is a
right.
lot of sugar. But don't come to the clinic for a free snow cone every day.
Yeah.
Just the health fair.
Just the health fair. Yeah.
Right. So, okay. Anything else? I think we hit on pretty much all of your activities. And then don't forget about the Start Smart.
Start smart. Yes, we are starting the
Start
family smart.
Right.
Yes.
And that is all in August. Like that's kicking off in August. This is September. Health fair is
Yes.
September.
Yes.
Yes.
Yeah.
And if anyone did not get enough information from us today, they can call you, 447-0300.
And ask.
Website,
Yeah.
asthealth.org.
Yes. Now the referral system won't be on the website for the program. They will have to go through the provider.
Okay. But if they wanted more information,
Oh,
it's
yeah,
all
yeah.
on the website. Hours, I'm sure all at your clinics, your walk-in clinic, because I
Yeah.
know the testing was Tuesday, Wednesday, Thursday. See?
Look at you, Mindy.
I know.
Thank
I
you.
remember how many times have you been on here? So if they want any information, call you. It's on the website. Come see you.
Yeah.
The health fair.
Yeah.
Okay. Well, I think that's it. Hopefully you'll come back maybe a fourth time.
Oh, I don't know about that. People are going to get tired of
No,
seeing this.
never. I mean, it's important work. And
Right.
It's smart. Start smart.
It's smart. Yeah.
It is smart. It's great
smart.
work. And I want to thank you both for all the work that you do to support the health and well-being for the community.
Oh, thanks.
Thank you.
Thank you, guys.
Yeah.
Thank you for listening. I'm Mindy Longhorn. We hope you join us next time as we talk Among the Shawnee.
Yawe, ye si hakueta wiani. Salanoki ke no le poa.